We took patients with stage 3 non-small cell lung cancer that was not amenable to surgery. And those patients were treated with what we would have considered the standard of care, which would be concurrent chemotherapy and radiation. And then the trial placed those patients, all the patients in this case, on a drug called pembrolizumab, which is a PD-L1 inhibitor or a checkpoint inhibitor, a form of immunotherapy. And those patients received that therapy for up to 1 year. And what we were looking for was whether we could improve the time to the development of distant cancer or death in those patients. And we also looked at the development of local cancer and also overall survival. And the study looked at all those endpoints as well as the toxicity of adding that medication after concurrent chemoradiation. When we compare the addition of this immunotherapy medicine to what was the previous standard, which was just chemo and radiation followed by observation alone. When we add this medicine, it looks like it significantly delays the time to patients developing distant cancer, delays the time to patients developing a recurrence of their cancer, and we hope that eventually we're going to see an improvement in the survival of our patients and hopefully an increase in the cure rate of patients after concurrent chemo and radiation. So thankfully, patients are doing well enough on this study that we haven't gotten to the point yet where we can really say whether it improves their survival or not, though based on how well they're doing, we're hopeful that that will be the case. Our study was similar to another study, which has come out in the last year, showed very similar findings. We think our study confirms their findings. The addition of these medications and the improvements that we're seeing are very exciting, both for us as physicians, but also, very exciting for our patients. And we think the next steps, number one, is trying to figure out why the patients who didn't benefit. Is there a test that we can do prior to giving these medicines that will tell whether or not they will actually respond to them or whether or not their cancer will come back? Is there something about their cancer or the way their chemo and radiation was given that can help us understand why their cancer returned and someone else's did not? And then to build on the future and newer therapies, we have to see whether adding things on to this immune therapy regimen may help improve outcomes even further. The standard of care for stage 3 lung cancer is really changing. And if you or someone you love has recently been diagnosed with stage 3 lung cancer and been treated with chemotherapy and radiation, I think you should have a discussion with your oncologist about whether or not immune therapy may be the right choice for you.